I've talked about Nicola's story. Now I'd like to share another one with you. And he's going to be a key feature in a couple of minutes as we do something really exciting and very special. And his name is Fred Ketchen, who is sitting right over there. Many of you will be familiar with his name. For decades, he's been part of our family. But he's also been a renowned investment expert. He's been a governor and chair of the Toronto Stock Exchange, a commentator on both radio and national television networks, and has recently announced his retirement after a career spanning 6 decades in equity trading. Although he tells me he still goes into the office every day and really isn't quite retired, but you know, is taking a little more time out for himself. Now, I had dinner with him the other night, and I asked him, you know, tell me about this dedication to the hospital. Tell me why. And he told me, well, first of all, let me tell you a personal story, Michelle. When I was in my early 40s, I came to the then Mississauga Hospital because I wasn't feeling very well. And I thought I should go in and see a doctor in emergency. So in I went, and the emergency doctor, you know, checked me out and said, "Fred, you're having a heart attack." And Fred said, "I know all about healthcare. I certainly am not having a heart attack." And so the two of them went back and forth. And you know, Fred, I'm extremely very, very thankful that the doctor convinced you that he was right. You know, and that you're here today because indeed you were having a heart attack. And you received absolutely magnificent care here. And your other story about this hospital is that it's a family affair. Your father was the first chair, Mansell, of the South Peel Hospital Board, and your mother, Vera, was the past president of the Hospital Auxiliary. And Fred was actually at the groundbreaking ceremony of the South Peel Hospital in 1958, which is now the Mississauga Hospital, where you are right now. And he told me that he was a member of Rotary, and Rotary and the Lions Club came together because they really believed that a hospital right here was really important. So a lifetime resident of Mississauga, Fred joined the Trillium Healthcare Foundation Board in 2000, keeping up the family tradition of getting personally involved. He served in a number of capacities, including in my role, chair from 2004 to 2006. You know, you're a caring and humorous and inspirational person. Your example has inspired all of us to do more. And I now like to invite Steve Hochet, Foundation President, to join me here, and Fred, because we have something very special to tell you that will inspire you further to make a contribution to this hospital. So come up.
Thanks so much, Michelle. Firstly, I'd be remiss not to mention your inspiration, your dedication, and your generosity of spirit. We would not be here today as an amalgamated Trillium Health Partners Foundation without your fantastic leadership. So thank you for being such a great friend and mentor and such a wonderful board leader. So a big round of applause for Michelle Darling. So Fred and Michelle and everyone in the room wanted to introduce you to our interdisciplinary health team that we have here and our wonderful volunteers. They're here to join us in helping us make a special announcement. Together with our community, we are about building for the future, a future of sustainable, accessible, quality health care so that our team can continue to excel at what they do, and so that our community can have access to the right care at the right place in the right time. And with our community's investments, together we are also building health, hope, and life. Fred, that's what you're helping us build. Today we're very proud to announce that Fred Ketchen is making a significant investment in our hospital and our community. $5 million to create a new kind of health care for a healthier community.
You're not adding more zero.
So thank you again, Fred. What a wonderful investment in our community, and thank you for your confidence in this organization. And I've been very fortunate to have learned from Fred and an opportunity to work with him over the years. He's an inspirational leader, a mentor, and a friend. So on behalf of the foundation and on behalf of the hospital, thank you for investing in us. Thank you for your humility, your community service, and your generosity, all being so exemplary. And in the words of Winston Churchill, and I think about Fred when I read this, we make a living by what we get, but we make a life by what we give. So thank you for giving to us, Fred.
Thank you.
A special presentation for Fred here, represented of all three sites of the Trillium Health Partners.
I recognize that.
I think what's truly inspirational about this gift, it is an investment in a new kind of healthcare for a healthier community. It's not focused on one program or one site, but across all of Trillium Health Partners. So thank you so much, Fred.
Thank you. Thank you. Thank you. I thought this one was going to go up my nose, but I was a little bit more careful. This is a special day. It's a special day for the hospital, but more so, it's a special day for myself and my family. As you have heard from time to time, the Ketchen family and the South Peel Hospital and Trillium Health Center have worked together over a long period of time. And my father certainly was either the first or the second chairman of the hospital board, because the whole thing originated from the Lions Club of Credit Valley and the Rotary Club of Port Credit. And together they worked tirelessly in order to raise the amount of money that was required to get the shovels moving and to get a 50-bed hospital built. As somebody said, maybe it was you, Michelle, that when they broke the sod out on the front lawn, I had the opportunity to be there as one of the members of the audience, and they came out with a couple of shovels, and my father was one of the ones with a shovel, and I think Gordon B. Jackson, a local lawyer, was the other one with another shovel, and they dug a couple of holes, and I wondered how the heck you dig a couple of holes like that, are we going to get a 50-bed hospital built? But nevertheless, through perseverance and a lot of sacrifices by a lot of people, not just my family, but a lot of families in Port Credit and Lakeview and Clarkson and Lorne Park and Spots North, they accomplished what they set out to do. And I think that obviously it has helped very, very many people in this area. The reason why we needed a hospital here was because, well, first of all, at the time after I was born, I lived on a road called Orchard Road. If you know where Orchard Road is, it runs north from the Lakeshore Highway, 1 block east of Dixie Road. And I lived on Orchard Road for a long time. And it was a good life, and all was good. We had our scrapes and came to the clinic or down to Mimico, where there was a small hospital, in order to have ourselves fixed up. But as more members of the family arrived, I don't know, the stork was very busy at our house for some other reason, but none of us, all 6 of us, I have 2 brothers and 3 sisters, none of us was born in Toronto Township, they called it at the time, because there was no hospital here. My mother was transported down to St. Joseph's Hospital in Toronto, and that's where all the 6 births took place over a period of maybe 11 or 12 years. I have kept my relationship with St. Joseph's Hospital. It's a special place because it is the place where all 6 of us were born, And we had an occasion late last year where we went down and we spent some time at St. Joseph's, and I made a small contribution to their foundation because when you give birth, not me, but when there is a birth and 6 of them all at one hospital like that, seems to me that if we're going to be good citizens of our community and our country, we need to give back. And so I've tried to do my fair share with the St. Joseph's Hospital as well. My first visit to a hospital was down to St. Joseph's, and I was a 6-year-old stupid kid. And in the backyard, my father always used to like to have a garden, and he had a garden with vegetables and fruit trees, and there were some rhubarb. My first great mistake in life was figuring that if you can eat the rhubarb, why not eat the leaves as well? You can't eat rhubarb leaves because it burns the lining out of your stomach. So off I went, and Dr. Stewart's car, lying down in the front seat as he drove down to St. Joseph's, delivered me to St. Joseph's, and I think I was in the hospital probably 3 or 4 weeks while they had to do all the work to reline my stomach. But son of a gun, it all worked out, and I have eaten well since. So it certainly was a very important and moving part of fear, but thankfulness when it all came to an end. And when I was in public school, grade 1, 2, 3, 4, a very lovely teacher. She was a lovely blonde lady, and I've always had a soft spot for blondes ever since then. But she was a she was a lovely lady, and somehow she found out about my rhubarb leaf experience, and we maybe 3 times in grade 1 or grade 2, I had to get up and tell this story about what I did, what happened, and why nobody should ever eat rhubarb leaves. Very seldom after that have I ever eaten rhubarb itself, just for the very simple reason that maybe I thought whatever was in the leaves may have gone down into the real rhubarb stalk, and I might get it in second hand. But nevertheless, I think that my experience here from the very first days, over 60 years ago now, 60 years ago, I have kept very close to it. This is a wonderful organization. It's extremely well run, operated. The staff have been totally dedicated in any time that I have been around. And I got to tell you that it was not done purposely. The 50-bed hospital was put here, and now it's 200 beds. Now 250. More to come. The mere fact that the hospital is here and the funeral parlor is on the other side of the street means nothing. It's just convenience, and I'm rather glad to know that as well. So, so to the members of the Port Credit Rotary Club and the Lions Club of Credit Valley and all those people who started out so many years ago, to them and to all the people that have followed, and to all the donors who have been so generous in parting with some of their cash in order to keep this place going, to keep it improving, to keep it building, and to keep making it the positive force that it is in our community. I am very, very grateful for that, and I hope I hang around a few more years so I can do so again. Thank you.